Chelsea Roy, I'll be your dental hygienist today.
Nice to meet you.
You too. So I was just looking over your medical history and I just have a couple of concerns with it.
Okay.
So first I see that you have diabetes. Which type are you?
I have type 2 diabetes.
Okay, and when were you diagnosed with type 2 diabetes?
When I was 42 years old, I was told it was mostly because of my eating habits.
Alright, and how's your blood sugar usually? Is it high or low? Does it steady?
It's usually around 7. I take some medications to keep it under control.
And do you know what kind of medication that is?
Yeah, it's metformin, and I take two 500 milligram tablets twice a day.
Okay, and how else are you managing your diabetes?
Well, my specialist said that I need to improve my diet, so I've been eating more vegetables and really focusing on portion sizes as well, and a lot less sweets. And I also joined a gym recently. I thought that would help.
Yeah, going to the gym and staying active can really help manage your diabetes. How's that going with you? I noticed you walked in here with a bit of a limp.
It's going great, but I'm just a little sore from last night. I usually go about 3 times a week, and on the days I don't go, I try to go for a walk.
That's good to hear. And how's your overall oral health? Do you brush twice a day? Do you try to floss once a day?
I brush twice a day, and I try to floss as often as I can.
Alright, because we have to be extra careful if you develop any periodontal disease.
Yeah, that's been mentioned before. It's because I have slower immune system, and things don't heal as quickly with me because of my diabetes. Other than that, does my diabetes affect my treatment with you at all?
Exactly, and it can have a bit of an effect. Diabetics often are more susceptible to the development of dental caries, especially around the cervical region of the teeth, which are closest to the gums. And also, I'm aware that you have xerostoma, so these two factors together make you extra susceptible to them. And I'll give you a fluoride treatment today just to help with that. Is that alright with you?
Yeah, sure. Whatever helps. Also, that ulcer that was found on my left cheek has been kind of bothering me for the past couple days. Could it be anything serious?
To me, it just doesn't look very serious at all. But we have to be careful because you do heal slower. So I just did measure it just for a future reference in case there are any changes. And I'm also aware that you have osteoporosis.
Yes, I found out about that in August. I went to see my doctor like usual, and I told him about my back pain. So I ran some tests, and it turns out that I have early stages of osteoporosis. Now I'm on some Fosamax, which I take once a day, and I guess it helps with things. So do my visits to the gym.
Yeah, physical activity can help strengthen your bones. It's good to stick with aerobic, low-impact, or weight-bearing exercises like walking or jogging. But I'm glad to hear you're going to the gym often and managing it all right. Do you know what dosage of Fosamax you're taking?
Yes, it's a 10 milligram tablet.
Okay. And are there any other medications that I should know about? Don't worry, nothing is too embarrassing. I've heard it all before.
No, just my 2 medications. But I wanted to ask, can my osteoporosis cause any complications with my oral health?
There are possibilities, I'm sorry to say. It's often associated with the alveolar bone loss in your jaw, which can lead to an elevated risk of periodontal disease. But if you continue with your healthy diet, physical activity, and keeping up with your oral hygiene, you should have no problem. Are there any other concerns related to conditions that you have?
Well, for my xerostoma, I may need frequent drink breaks just because my mouth is so dry. I also need extra time for swallowing due to it as well. Along with my diabetes, like I said, my blood sugar is usually steady, so I shouldn't have any problems with diabetic shock.
Okay, and is there anything that I need to consider when treating you in regards to your osteoporosis?
I'll just need to be careful because I do experience a sore jaw sometimes, so I may not be able to keep my mouth open for very long, and it might be hard for me to lay back because of my back pain.
Okay, so I'll just make note of that. And I guess that's all for your medical history, so we can get started with your treatment now.
Okay.